Welcome, everyone, to another deep dive. Today, we're tackling, well, a really big one, a massive piece of legislation. Officially, it's the American Prosperity and Security Act, but you've probably heard it called the One Big Beautiful Bill. It's been all over the news, making waves. We've pulled together a whole stack of sources, health policy stuff, budget analyses, even some, real-world stories to really break down what this bill means for you, for families, for, well, American life, really.
It's absolutely right. And our goal today is to sort of cut through all that noise.
hmm
We want to delve into the major consequences, especially focusing on how these policies might negatively affect Americans based on the data. We'll be looking at objective analysis, expert reports and the sources you mentioned, trying to give clear context, connect the dots, but importantly, without taking sides. Okay, so let's get into it. Let's unpack this thing.
Okay, sounds good. So let's start right at the foundation, the money side. This bill seems built on extending tax cuts, adding new spending, but what's the real story for the national finances? And, maybe more to the point, who feels the impact and why?
Right, so if you look at the core of this act, the projections are pretty stark. It's expected to add about $2.4 trillion to what they call primary deficits over the next decade. And just quickly, primary deficit is basically spending more than you take in before you even count interest on the existing debt.
Okay, so that $2.4 trillion is just the start.
Exactly. Factor in the interest payments on that new borrowing, and you're looking at a $3 trillion hit to the national debt. And there's a catch. Some parts of the bill are temporary now. If those get made permanent later, well, that debt figure could balloon to $5.0 trillion.
$5 trillion, wow.
Yeah. And what's interesting here is the narrative difference. The White House suggests, economic growth will offset this, maybe even reduce deficits. But nonpartisan groups like the CBO, the Congressional Budget Office, and frankly, most economists, they strongly disagree. They're actually warning that just the interest payments could hit $2 trillion a year by 2034.
$2 trillion just in interest.
Per year. And that's where the crowding out comes in. It could mean less money available for other vital things, education, roads, maybe even defense, because servicing the debt takes up so much cash.
That really puts it into perspective. It's not just an abstract number then. Okay, but what about the tax cuts themselves? The argument is always they stimulate the economy, right? But who actually benefits, according to these analyses? Is it the average person?
That's the key question, isn't it? So the bill extends a lot of the 2017 cuts, adds some new ones. We're talking about $4.5 trillion in tax reductions overall. Now, some people might see, a bit of short-term relief. But the analyses we've looked at from places like the Yale Budget Lab, the CBO, they consistently show something else long-term. The benefits skew really heavily towards higher earners.
How heavily?
So, for example, the top 20% of households, they could gain around $5,700 more each year. The top 1%, maybe an extra $78,650 annually.
$78,000.
Annually. Meanwhile, at the other end, the poorest 20% of Americans are projected to actually lose about $700 a year. Middle-income families might see a modest gain, maybe $500 to $1,000 a year. So it's not just about a few extra bucks. It really looks like a potential reshaping of, wealth distribution. Could widen the gap. Makes you think about fairness, for sure.
That is a sobering picture on the financial side, but the bill's impact goes way beyond just dollars and cents, doesn't it? I understand healthcare is a huge area affected, significant cuts involved.
Yes, and this is perhaps where the consequences feel most immediate and, frankly, severe for many Americans. Based on the act and some related policy changes, the projections are that around 17 million more people could become uninsured.
17 million.
17 million. That would actually be the largest rollback of health insurance coverage ever due to federal policy shifts. Most of those losses, about 11.8 million people, are expected from big cuts to Medicaid and changes to the ACA marketplaces, the platforms where people shop for insurance. And then another 5.1 million could lose coverage because of a separate new administration rule, but also because some enhanced premium tax credits are expiring.
Wait, just pause there. 17 million uninsured. That's almost the population of Florida, like you said. What does that mean in human terms, beyond the statistics?
The implications are incredibly serious, potentially life and death. We're seeing studies, one in the Annals of Internal Medicine, for instance, estimating thousands of preventable deaths just from the Medicaid cuts alone, potentially over 16,600 people. Another analysis from UPenn and Yale puts it even higher, over 51,000 deaths per year.
51,000? How? How does that happen?
It comes down to access. People losing their main doctor, maybe not being able to afford essential medicines, skipping vital screenings like mammograms because they don't have coverage. And for patients with serious conditions, like cancer, groups like the Leukemia Lymphoma Society are sounding alarms. They're saying these cuts are a direct threat to survival for many, forcing, quote, impossible choices without good insurance.
Impossible choices. And it's not just about losing the insurance card itself, right? Are there other barriers being put up, even for people who might still technically qualify for something?
Absolutely. That's a really important point. The bill brings in stricter work requirements for able-bodied adults on Medicaid. Also, more frequent checks on eligibility. Now, on the surface, proponents say this saves money, promotes work, sounds reasonable to some, but the data we have from states that tried similar things, Georgia, Arkansas, shows something different.
What does it show?
It shows that lots of eligible people end up losing coverage anyway, just because of, paperwork hurdles, administrative complexity. And ironically, it often increases the administrative costs for the state. So you get what sources call onerous new red tape, a maze of barriers. Even people with severe conditions like cancer patients can just fall through the cracks.
So red tape tripping up people who actually need the help.
Exactly. And connect that to the bigger picture. These cuts put immense strain on rural hospitals. Many are already struggling financially, some could close. And if your local hospital closes, that affects everyone in the community, regardless of your insurance. Access just disappears. It really forces you to ask, what's the real cost of saving these dollars when lives are impacted so directly?
It's a grim calculation. So if immediate healthcare access is one major concern, what about the future? The long-term health of the nation, medical research, finding cures, we're hearing about cuts there too.
Yes, indeed. The bill itself and some broader administrative policies include pretty significant cuts to federal health agencies, particularly the NIH and the National Institutes of Health, which, as you know, is the world's leading medical research agency, the biggest funder for cancer research globally.
So what kind of cuts are we talking about?
Billions of dollars, plus the cancellation of hundreds of existing research grants and job cuts. Around 1,200 at NIH alone, maybe up to 20,000 layoffs across the entire Health and Human Services Department.
20,000 layoffs, that's huge.
Yeah.
Beyond the lost jobs, what does this throttle back in terms of finding new treatments for cancer, other diseases?
That's the crucial fear, isn't it? What happens when that engine of discovery slows down and patients are feeling it deeply? For instance, a survey by Fight Colorectal Cancer found 75% of patients were worried these moves would delay their care, slow down new research. We even saw a source mentioning one patient whose clinical trial for stage IV colorectal cancer just got canceled. Overnight, funding pulled.
Wow, just like that.
Just like that. It makes it very real, very personal. And the potential impact spreads to the more than 7,000 active clinical trials across the country. They're now potentially at risk. Experts also warn about what they call a scrubbing of science.
Scrubbing of science, what does that mean?
It refers to concerns particularly about pulling back funding for research into health disparities. Why certain minority groups or LGBTQ plus populations might have higher cancer rates, for example. Research trying to understand and address that. There are also worries about losing top scientists to other countries or students just choosing not to go into research because the future seems so uncertain.
So a potential brain drain, too.
Potentially. And even basic things like keeping public health websites up to date, cancer.gov, the physician data query doctors use that's at risk with staff cuts. Sources called that very dangerous for doctors and patients who rely on accurate, current information. It's concerning for public health now and for America's leadership in health innovation down the road.
It really seems like the ripples spread out far and wide, not just healthcare then. What about other safety nets, like food assistance? And then there's energy, the environment. What are the sources saying there?
You're absolutely right. The effects do ripple out. Take food security. The bill shifts some costs for SNAP, that's the Supplemental Nutrition Assistance Program. Food stamps basically shifts costs to the states. It also raises the age for work requirements. This could affect millions. The CBO estimates about 4.7 million SNAP participants could lose out.
4.7 million losing food assistance.
That's the estimate. And beyond that, one analysis we saw projected 18 million children could lose access to school meals, and maybe 3 million people losing other federal nutrition aid. This just adds another layer of financial strain, potentially even for middle-class families already dealing with higher costs elsewhere.
Okay, and flipping to the energy and environment side, the argument there might be about reducing regulations, boosting the economy. What do the analyses predict?
Well, the projections from the sources we reviewed are pretty starkly negative on this front. The bill largely gets rid of numerous tax incentives that came from the 2022 Inflation Reduction Act. These were incentives supporting clean energy, electric vehicles, energy efficiency programs, things like that.
So it undoes those.
Pretty much terminates them. And this directly undermines the sort of clean energy boom we've been seeing, threatening what sources call hundreds of thousands of good family-supporting jobs in that sector. It's actually quite striking. Elon Musk, who has been a Trump ally at times, publicly called this part of the bill utterly insane and destructive.
Elon Musk said that.
Yeah, warned it would destroy millions of jobs and really harm the energy sector. And critically, if you gut those clean energy tax credits, communities likely become more reliant on fossil fuels, which are often more expensive and polluting. Projections suggest families' energy bills could go up maybe $110 next year, over $400 per year within 5 years.
Higher energy bills on top of everything else.
Potentially. The bill also rolls back fuel efficiency standards for cars and trucks. That means they could be more expensive to fill up and emit more pollution. And there's another piece, a sort of pay-to-play system introduced. It could allow big corporations to basically pay a fee to bypass environmental reviews for projects that might pollute, which, raises obvious concerns about clean air and water in communities near those projects.
A pay-to-play for pollution reviews is something.
Hmm.
Okay, shifting gears again slightly. Beyond the economy, social programs, environment, immigration is also a major part of this bill, right? What are the consequences highlighted there, particularly for people already living here?
Yes, immigration and border security get substantial funding in this legislation. We're talking hundreds of billions allocated for things like border wall construction, expanding detention centers, hiring more ICE agents. The stated goal, cited in some sources, is to carry out the largest mass deportation effort in U.S. history.
Largest ever. What does that look like on the ground based on the sources? What's the human element?
Well, this is where some deeply troubling cases emerge in the documentation we reviewed. For instance, reports of U.S. citizen children being deported alongside non-citizen parents, including one case of a 4-year-old citizen child with stage 4 cancer allegedly sent away without medication. Another involved a pregnant mother of a 2-year-old citizen deported reportedly without ensuring continuity of her prenatal care.
Deporting U.S. citizen children, how is that possible?
It raises serious questions about due process. Some judges involved apparently expressed strong suspicion that children were removed with no meaningful process. Advocacy groups like the ACLU highlighted reports that families were isolated during key decision points, unable to speak to lawyers, despite existing rules about caring for minor children in these situations. It really brings up that difficult question: when does heightened enforcement potentially cross the line into denying fundamental rights or access to essential life-saving care, and what are the downstream effects of that?
These are incredibly profound changes across so many areas: healthcare, economy, environment, immigration. So with all this going on, how is the American public actually reacting? Is this big, beautiful bill popular? Are people okay with these consequences?
The polling data paints a pretty clear picture, actually. This bill seems deeply unpopular. Recent surveys consistently show a majority of Americans, often somewhere between 53% and 64%, opposing the measure. And that opposition has actually grown since the plan was first announced.
Grown. So people are liking it less over time.
It appears so. And when you ask why they oppose it, the reasons are telling. Over half believe the federal deficit will go up because of the bill. A similar number expect it will actually hurt the average American. And many anticipate that they, personally, and their own families will be negatively affected.
So even though the official messaging might be about helping hardworking Americans, the public isn't buying it. There's a disconnect.
That seems to be exactly right. The perception doesn't match the pitch. In fact, polling shows majorities of Americans want funding increased for programs like Social Security, Medicare, and Medicaid, not cut. Now, there is some bipartisan support for stricter eligibility rules, like those work requirements for Medicaid we talked about, but the overall feeling is strongly against slashing funding for these major social programs.
Interesting. Even some political pushback.
Yes, even some Republican senators voiced concerns, particularly about the Medicaid cuts. Tom Tillis, for example, publicly expressed his worries and later announced he wouldn't seek re-election after voting against the bill on that basis. Which really leads you to wonder, doesn't it? If public opinion is so clearly against it, and the projected negative impacts are detailed in these analyses, why did this bill pass in this form? What dynamics are overriding public sentiment and expert warnings?
That's a huge question. We've really covered a lot of ground today. A true deep dive into the consequences of this legislation, the American Prosperity and Security Act, or the One Big Beautiful Bill,
Hmm.
from healthcare access and medical research funding to food security, energy costs, immigration policies. It's clear these shifts are poised to touch almost everyone in America in some way.
Indeed. And understanding these connections, the sort of direct consequences, is just so crucial. It's not just abstract policy debates happening far away in Washington. It's about very real potential impacts on your life, your family's health, your wallet, and the future of vital services right there in your community.
So, thinking about all this, what's the takeaway for you, the listener? Maybe consider this. In today's world, with so much information flying around, are we really equipped to grasp the long term kind of cascading effects of these incredibly complex laws? Or do we end up just reacting to the headlines, the sound bites, the stated intentions, rather than the likely outcomes documented in analyses like these?
Yeah, the insights we discussed today are really meant to offer a clearer lens, hopefully. We definitely encourage you to keep exploring these issues, keep asking those deeper questions about how government policy actually translates into your personal reality.
Thank you for joining us for this really important deep dive. We hope it's given you a more informed perspective as you think about what's next for America.